make a start. So I hope you all enjoyed your workshops, and thank you for rejoining us for the main session. I'd now like to introduce Dr. Afrosa Ahmed with pleasure. She's a KCL alumni, GP and mindfulness coach, having graduated from the UK College of Mindfulness, Meditation, and established a mindfulness wellbeing program, Med24. And she's going to be talking about mindful living, the science and the practice.
Thank you for that introduction, and thank you for having me. It's lovely to come back to home. As I was saying in the workshop, I graduated from UMDS, so it shows how old I am, before it merged with King's, and I met my husband on my medical degree, so I know students love it when I tell them that. So all right, a little bit about myself. As you've already said, I'm a GP by day. I've been a GP for over 15 years now. I teach at UCL and King's, a school governor, and I've written books and articles. And I do as a mindfulness coach, was mainly in the private practice in Harley Street and Med24 in Paddington. And the hardest job is mother of 3 boys by far. Right, so what is mindfulness? I alluded a little bit to this in the workshop, but just go over it again for those who couldn't join us. Mindfulness is essentially about the now moment. You know, we spend a lot of our time in the past and the future. And some alluded to this in the workshop, that we spend a lot of our times doing things. So we get up, we brush our teeth, we have breakfast, we go to work, we come home, we have dinner. Our life essentially becomes a set of mundane routines, and we do things out of habit. We react to situations and to people out of habit. Certain situations will evoke reactions, and the same reactions, and it's like a cycle. And people get this idea that they're in a rut, and we get that feeling that we're in a rut and we relive in the same things. It means that we're constantly in a state of doing. We're doing the dinner, we're doing the work, we're doing a project, we're doing a meeting, we're on our phones, the social media, the planning. We're constantly in this doing mode, or we're doing something. And even when we think we're resting at the end of the day, we might be on the couch, we're still doing. We're either watching TV and scrolling our phones at the same time, or we're planning tomorrow, catching up with emails. We're still in that doing mode. And that has become a default way of life for us, because this is something we just do all the time. And even when we're trying to sleep and we're not trying to do something, we're still doing, because our minds are still ruminating. And that leads to very broken sleep. We have difficulty getting to sleep because we can't switch off. And what that means essentially is that we walk around, experience a lack of joy and happiness in our lives. We live in this heightened state, not able to be fully relaxed, not able to be just calm and at peace. And we find this very difficult when actually it shouldn't be difficult. Like I say, when we're sitting, we're just thinking about things. When we're on a holiday, our minds might be on something else. So how do we break away from this? With mindfulness, we try to train ourselves. It's kind of a form of mental reprogramming, of bringing your awareness to the now moment, to stop doing and to just be. Sounds simple, but it's something that takes time because we're just not used to it. We break free from this doing mode, we enter a restful state, and we can do this formally as a mindfulness meditation practice, and we'll do 10 minutes at the end. Some people experience this in the workshop, and we nourish ourselves mentally and physically, and we come out of that autopilot mode that we're so used to. We also break free from that repeated negative thinking that we give ourselves. We're probably our worst critic. We spend a lot of our time planning and predicting the future, and we come to the only real moment which exists, and that is now. Most of what we plan and predict actually never happens. So by using so much mental energy in the past and ruminating about the past and predicting the future, our minds, they're just in a state where they love to analyse. If you already predicted how a certain thing is going to be, opportunities pass you by and you don't experience joy. I don't know if you guys feel this is common, but sometimes our thoughts become scattered. They're everywhere because we're so used to doing all the time and doing multiple things at once. People multitask, and now studies have shown that that's not the best way to do things. And this whole feeling, it gives you a feeling of being overwhelmed, which can lead to exhaustion. We also by freeing ourselves from the past and the future and living in the now, we also free ourselves from this thinking that we have, I'm going to experience happiness and joy when I get my dream car. I'm going to experience happiness and joy when I become a size 10. I'm going to experience happiness and joy when I go on that holiday. If you're always waiting for an external event, then the true happiness will never happen. So what we say in mindfulness, experience happiness and joy now. You don't need to wait, and we can do that in a mindfulness practice. And people often ask me, why do I get into mindfulness? And I can't really say it was a personal event. I think it was something that I felt with my patients, I wanted to give them more. And unfortunately, on the NHS, we're still trying to find ways of implementing mindfulness. Guy's and St Thomas's has a well-known mindfulness clinic, actually. So it is there, but not as much as we'd like. I was writing prescriptions, or I might refer someone to counselling. Again, the options were very limited. We didn't really have the time to deal with patients with chronic illnesses. When I was thinking, am I really making a difference in these people's lives? So I kind of explored myself different options. I know doctors, colleagues who have taken their lives, so this is something that affects us as practitioners. And I found that mindfulness was probably the most simplest form. You don't need anything, you don't need any props, you can do it anywhere, anytime. And probably the cheapest form of therapy. And whatever form it needed to be, it had to be a mind-body approach. And we did that in the workshop. I tried to prove to people that just by thinking things, we can evoke a physical reaction. So mindfulness isn't about changing yourself, it's about recognizing, accepting who you are, where you are in that moment. It doesn't promise you to get rid of triggers or external triggers in your life. You're going to have that exam, you're going to have that deadline, there's going to be people in your life that you don't particularly get on with. But what it does is change that reaction to that event, how you cope with that event and how you approach that event. People think that mindfulness is kind of like a fad, maybe something mystical or religious, but it's actually been around for centuries. And it's probably more relevant today than it has been, the way that kindness and compassion has always been around. It's something that's needed, that can be practiced by anybody. It's not associated with any religion that people think of. And it can be, from anyone can practice it. And I say it sounds easy being present, but it takes time to master. When you do the mindfulness practice, you'll notice your mind wanders all the time. And we're so used to doing things at the same time, multitasking. When we were babies, someone fed us. When we were hungry or cold, someone clothed us. But our needs evolved. We developed things like loneliness and boredom and stress, and we didn't really know how to cope with it. And through no fault of our own, we turned to other things like food or nicotine or alcohol. So mindfulness is trying to fill that void by self-help therapy, I would say. And again, it's so simple because all you need is to show up. You just need your breath. So people love to talk about science and how we prove things these days. This is just an MRI scan of the difference that meditation can make. Just for the purpose of this talk, I use two words interchangeably, mindfulness and meditation. Slight difference, but it doesn't really matter. Mindfulness has been around for centuries, but actually it was made very common by the physician John Kabat-Zinn, and he brought mindfulness and meditation together in the 1970s in America, and he was a cognitive scientist, and he used mindfulness-based stress reduction as an alternative therapy for many medical conditions. And he did this in a very scientific way. He used like a mind-body approach to healing. So he got two groups of people, those who had the traditional modalities of treatment, such as drugs, and the others who had mindfulness meditation. And then he used brain scans to look at the effect, and there were really positive results. In the UK, Professor Mark Williams, who's at the Oxford University, he really altered our understanding of depression, and he developed mindfulness-based cognitive therapy, which is a treatment for anxiety and stress. And it's proven to be at least as effective as drugs in preventing new episodes of depression. And it's one of the preferred treatments in the UK's NICE guidelines. So you can see in the MRI scans, certain known effects of meditation and mindfulness in the amygdala, which is a region for stress, that's become smaller. It's also proven that areas in the brain for planning and problem solving, that has become thicker in patients who practice mindfulness. And the hippocampus, which helps with your memory and learning, that also can become thicker after practicing mindfulness. Now, those are some of the physical structural changes. There are chemical changes that happens in our body when we practice mindfulness. When we're stressed, we have a physical response, the autonomic nervous system. I'm sure many of you know this. The sympathetic nervous system prepares our body to react to stress. and the parasympathetic will help you recover. So when we're stressed, essentially chemicals are released, such as cortisol and adrenaline, and increases your blood flow, heart rate. You might notice it when you're having a stressful event, or just thinking about a stressful event will do that as well. The body can't distinguish between what's real and not. And what will happen is usually the body can recover. The high levels of stress hormones, it sends a signal to the brain, and it activates the parasympathetic nervous system, and the opposite happens. The heart rate comes down, the blood pressure slows down. All this happens quite naturally. Now, certain situations we happen is chronic stress. So in chronic stress, such as a demanding job, a difficult relationship, a family life, we're continually being exposed to stress. So those hormones are continuing in our system. The parasympathetic nervous system isn't activated and cortisol remains in our body. And this is the stress that's dangerous. And in our constant fast-paced life, that's the most common stress. And as you can see, leads to lots of physical problems. So we need some sort of self-help therapy, that's such as yoga, Tai Chi, mindfulness. It doesn't have to be mindfulness, but look into something. And whatever you do, try and be consistent with it. Give yourself time and patience. Your body will fight it, your mind will fight it. It wants to do things. It's been doing things a certain way for years and years, so be open to the process. But there are obviously very many side effects of having chronic stress. These are some of the proven benefits of mindfulness that we know about. Anxiety, remaining calm, improves creativity, well-known mindfulness pain relief program that's run at Guy's. People know it's improved with sleep and memory and just feeling more energetic. So what do you need? Nothing really, just to show up. It's really that simple. Awareness of yourself, that's what we do. We don't fall asleep in mindfulness. We try to stay awake. We use the breath as an anchor. And notice that, when you're stressed next time, notice what's happened to your breathing. When you're relaxed, notice what happens to your breathing. And we use that kind of as a weather system. Before a stressful event comes, notice your breathing. And you can use that to predict what certain situations will be like, and hopefully get a hold of it. Commitment, I think, is the biggest thing. We all say, we've all been there, that we don't have the time. I say we all have time, we just need to allocate it in a different way. So consistent, 10 minutes every day, build up to 20, 40, but give yourself time. It's a gentle process. It's definitely not a quick fix. And have an open mind to the process. It's a very quick talk. Hopefully I've convinced you the benefits and the evidence behind it. We'll do a quick session, 10 minutes at the end, and hopefully you'll find a difference in just 10 minutes. Thank you.